A very good morning to one and all present here. I am Dr. Janani, a senior resident in the Department of Psychiatry at Sri Lakshmi Narayana Institute of Medical Sciences, and I'm here to present my presentation on prevention in psychiatry. Before going into prevention in psychiatry, let us know about what health is defined by in WHO. What is health? It is not merely the absence of disease, but also a state of complete physical and social well being. What is mental health then? So, WHO says that it is a state of well being in which the individual realizes his or her abilities, can cope up with the normal stresses of life, can work productively and fruitfully, and is also able to make contribution to his or her community. Now, let's come to what prevention in psychiatry is. Introduction. It is the reduction of mental disorders and behavioral problems, and it is said to involve two steps. One is identifying the risk and protective factors, and then applying the evidence based interventions for the same. It had been the mainstay in the field of public health, and this population approach is now being embraced gradually in the medical health field. It has two classifications. That is the traditional public health classification, which includes the well known primary, secondary, and tertiary prevention, and a newer classification put forth in 1994 by Institute of Medicine, which includes universal, selective, and indicated preventive interventions. These three actually constitute the primary prevention in the traditional public health classification. So it has eight principles considered by mental health professionals to endeavor into their onset to become prevention minded clinicians. And according to the Institute of Medicine report, the term prevention is purely reserved for those interventions that occur before even the onset of a disorder, while treatment refers to interventions for individuals who meet or are close to meeting the diagnostic criteria of a condition. What are the eight principles that they said before? They said that the application of prevention efforts in mental health, it is based on epidemiological findings. And practicing prevention in the field of mental health, it requires an understanding of the risk factors as well as its protective factors. And evidence-based preventive interventions can be applied in clinical setting. And for patients with established psychiatric illness, important goals should include prevention of a relapse, especially in case of a substance abuse, suicide, as well as adverse behaviors which are associated with further development of the physical illness. And this clinic based prevention, its efforts should be focused, it should also focus on the family members of the individuals with psychiatric illness. And the primary and secondary prevention should start often at the school, that is the fundamental basic levels, like in school, the workplace, and as well as in the community settings. And the mental health professionals should know that they have a role in achieving broad intervention goals, which is not, it is more beyond the prevention of mental illness, such as prevention of delinquency, bullying, behavioral problems, prevention of unwanted pregnancy, all these which act as stressors. Mental health professionals can also play a role in promoting mental health, overall health, and the wellness. Now, coming to the traditional public health classification of prevention, it includes the primary prevention, the secondary prevention, and the tertiary prevention. So, what does primary prevention mean? It keeps the disease or an adverse outcome even before from occurring. For example, in medicine case, vaccination, and in case of psychiatry, reducing risk factors from occurring. That is, adverse childhood experiences by targeting the parents of the children and explaining to them the importance of the childhood trauma, which can in future result in conditions like depression, delicacy as well. And secondary prevention, it interrupts the disease process even before it comes and becomes a disease. For example, in medicine sense, mammography for screening of breast cancer, and in case of psychiatry, screening for depression and suicidal ideation, even when a person shows slight dull appearance or sad appearance, in order to identify those factors earlier. And tertiary prevention means it the social and physical consequences of the disability that has happened after the disease has set in. Example in the medicine sense is rehabilitation following a cerebrovascular accident. And in case of psychiatry, an alcohol dependence has been established. So, relapse prevention in such a patient is what is called tertiary prevention. So, the disease has set in, and we do not want it to progress any further or to limit the disability. Tertiary prevention comes into role. And this is one example of s- substance use in the society, how it can be prevented in means of primary, secondary, and tertiary prevention. So, primary prevention, it includes the entire population. So, new cases of problem behavior or procuring substance, and this paradigm says that problem behavior here pertains to risk posed to health. Any behavior which is posing a risk to health. So, all that, reducing all that is primary level prevention. And when it comes to secondary level prevention, it includes reducing the current cases of problem behavior. That is, the current after alcohol use has settled in, what further results in its relapse or behavioral disturbances associated with it, treating the alcohol, its delirium complications, and all that pertain to secondary level of prevention. And tertiary prevention is the reducing complications, intensity, and severity of the current cases by means of establishing Alcoholic Anonymous, motivational enhancement therapy, relapse prevention strategies, group therapy for alcoholics, all by all these measures, preventing further deterioration in their health. Coming to the Institute of Medicine's classification of prevention, which includes the universal prevention, selective prevention, and indicated prevention, all these majorly comprise of the primary prevention. What happens in universal prevention is it targets the whole population or the general public. For example, in medicine sense, fluoridation of drinking water for prevention of cholera, and in psychiatry setting, uh, giving newsletters, media campaigns in case of alcohol use, but and as well as setting drinking age limits in order to prevent early onset of substance abuse. So the general population as such is targeted here. Selective preventive intervention includes targeting individuals or subgroup of the population who have risk of developing a disease or a disorder. In case of medicine, you can say that lifestyle modification in hyperlipidemia management, or if a familial hyperlipidemia is there, selecting the familial lineage, the further future generations as selective subgroup, and giving them lifestyle modifications. And in psychiatry setting, group-based psychological treatments for children of depressed parents can be made. And in indicated preventive intervention, it targets very high risk individuals who have very high risk of developing a particular illness. So here, in medicine sense, it becomes detection and targeting treatment of metabolic syndrome. So they have gotten metabolic syndrome. So we are detecting it and we are giving them targeted treatment. And in psychiatric sense, a patient has a prodrome of schizophrenia, so we are identifying it earlier and we start treating them at the prodrome stage itself before the disease sets in, that is. So, as I mentioned earlier, the Institute of Medicine's classification of universal prevention, selective prevention, and indicated prevention all come into primary prevention in the traditional sense of prevention classification, while case identification, standard treatment of known disorders, which comprises treatment, comes under secondary prevention, and compliance with long-term treatment, prevention of relapse, then aftercare, including rehabilitation, which includes the maintenance phase, all come under the tertiary prevention. Now, coming to what a risk factor is. So, risk factors, it predates the associated disorder. So, some are malleable to change by means of preventive intervention. So, example for it is biologically uh, a genetic vulnerability being expressed or an adverse prenatal event. All these can be prevented. And psychological or psychosocial sense, a family discord or parenting skill deficits can be prevented. In social environmental sense, availability of drugs, extreme economic social deprivation, all that can be prevented. And protective factors as also predate the associated disorder, and they reduce the risk of developing a disorder. And some are malleable to change by preventive intervention, that is because of resiliency. Example of supportive care from caring adults or good performance, conflict resolution skills, positive role models of peers, clear, consistent discipline in family all play a protective factor in an individual's growth. And this acts like a resilience to them and improves their stress handling capacity. So, what does all these do? And what is the outcome of prevention? So, it says that it has reduced a lot of specific disorders, example, substance use and depression. And it has also reduced risky behaviors like substance use, unsafe sex. It has reduced a lot of negative outcomes like suicide, teen pregnancy, school dropout, delinquency. It has as well promoted mental health and wellness. There has been a lot of delay in the onset of many illnesses, and there was also recorded decrease in incidence and prevalence of numerous illnesses. And it thereby led to minimal adverse impacts on the family, the peers, as well as the society. And this preventive outcome, because it targets a general population by means of campaigns or all the scientific evidences, there is a cost effectiveness is demonstrated here, because once a disease sets in, we might need a lot of money for it for us to treat the illness and for us to rehabilitate or further decrease in complication of the disease. Now, coming to the evidence-based aspect of prevention, so it the determination of any preventive measure for its effectiveness or efficacy, it's truly based on scientific studies, and it downplays the intuition and unsystematic clinical experience as sufficient grounds for decision making. So all this could be avoided, and the interventions here, that is the even preventive strategies here, are tested in systematic, empirical, and rigorous ways before being made into practice. Now, example of primary prevention is prenatal micronutrient supplementation. So many retrospective epidemiological studies, randomized prospectus trials have said that it assists the development of emotional and behavioral problems and cognitive deficits associated with future mental illnesses as their outcome. So, here, folic acid and phosphatidylcholine supplements have shown evidence for improving the childhood emotional development associated with later mental illnesses. So, during pregnancy or prenatal period, folic acid and phosphatidylcholine supplements are very important for prevention of diseases like autism spectrum disorder or schizophrenia. Even vitamin A and D are when they are decreased, there have been risk for schizophrenia and autism in many retrospective observations. Omega 3 fatty acid supplementation during early pregnancy it has found to have increased risk for developing schizophrenia and increased ADHD symptoms, but in later pregnancy, it has decreased childhood wheezing and premature birth. So that is one example for primary prevention, which can be addressed at prenatal level. The basically the micronutrients and all that. Now coming to examples for universal intervention. In case of preventing marital stress and divorce in married couple and couples planning to marry, interventions like group sessions, which are like couple therapy, aids in building skills to handle disagreements better. And in case of, in order to prevent poor school and family bonds, violence, substance abuse, risky sexual behavior in the elementary school age children, interventions like modified teacher practices and parental training should be done in childhood behavioral techniques. So they are the primary caregivers in case of children, elementary school age children. So addressing these issues to them and their behavioral modification in child rearing practices really can impact the children of that age group because they are the sole person who are in contact with them for most of the time. For examples in selective intervention, in case of prevention of alcohol abuse among college students, we target high risk drinking behavior in students as population, and for them we give motivational interviewing and skill training to help them mature out of their high risk drinking behavior. And in case of preventing protracted bereavement, depression, and social withdrawal in new widows, we can pair them with widows and pro- in turn who can provide emotional support and practical assistance to them. In indicated intervention, example for it is there is a risk factor. So, how to delay or prevent the onset of schizophrenia? The target population are those with prodromal or subthreshold symptoms. So, in them, we can try giving low dose atypical antipsychotic and cognitive behavioral therapy for them to delay the onset of the illness. And for a more, and this is a more focused example, how can conduct disorder be prevented? This is one example. As universal preventive measure, we can try behavioral management strategy, child social skill intervention strategies, and multimodal school programs. This is at the universal level, that is general population. In good behavior game, what is done is social demands of the classroom are met through overt encouragement of the desired behavior and discouragement of undesired behavior. And in child social skill intervention, it has two principles, that is, I can problem solve, promoting alternative thinking strategies. Here, children are provided with alternative cognitive skills that can help them cope better in difficult social situations. And in multimodal school programs, it has components of bullying prevention program, child development project, Seattle social development project, and linking the interests of families and teacher program. So what these all did was it combined a school-based child social skill intervention with parent management training, which proved very effective in preventing conduct disorder, that is. And when coming to selective prevention group, in that it includes prenatal early childhood programs strategy and school or community-based programs as strategy. So those they included nurse family partnership incredible years program, and these programs reduce the risk factors for conduct disorders like maternal smoking during pregnancy because the nurses were field trained and went to homes with pregnant mothers, and it explained or psychoeducated them regarding the risk of smoking and other substance use and child abuse on the mental health of the child present at their home. And school or community based program which included adults and transition program here, they had successfully targeted child social and problem solving skills and parent management skills, and this thereby led to a decrease in negative parent child interactions and teacher ratings of conduct problems at school. And for indicated prevention in case of conduct disorder, fast track program and strategies were included. So through this program, the childrens with potential of developing conduct disorder, they displayed lower levels of conduct problems, which was both observed by the teacher as well as the parents throughout their school years. And they participated in variety of interventions, including social problem solving skill training, that is the PATS, play sessions with pro-social peer partners, and by means of academic tutoring. So, what are the general principles for preventive programs? They address the factors that play causal roles, and they try to reverse or reduce the risk factors. They enhance the protective factors to increase competency in multiple domains, and they are tailor made for age to be age specific, and they are developmentally appropriate and culturally sensitive. So, New York Society says that any physician or a treating practitioner should have prevention minded treatment. That is, the intervention for is for a whole family in which the individual with mental disorder receives treatment. What is the role of mental health professional in prevention? So they incorporate knowledge of risk and protective factors into their clinical practice. They promote awareness of benefits of prevention, and they should form a liaison with school and community agencies and also collaborate with prevention groups to work together at reducing common risk factors as well as promote protective factors. So, how can it be done at a macro level to improve quality of life? By improving nutrition, by improving one's housing, by making the accessibility to education easier, reducing economic insecurity in all families by providing financial aids of appropriate duration, and strengthening community networks for their appropriate socialization and education or communication, and reducing harm from addictive substance use by bringing them into government policies and prevention of substance use. For example, mainly if we know that cannabis is banned in India, it's illegal to consume cannabis or grow cannabis. Such strategies can harm from reduce procurement of the addictive substance per se. So what does this entire flow chart says? So for a proper entire development or prevention in the entire community for any illness or a disease, there should be a policy so that all the levels of age, that is prior to consumption, prenatal period, infancy, early childhood, early adolescent, early adulthood, all these entire age group get affected by the policy making made as shown. And community interventions of passing on information about particular illnesses and information about appropriate macronutrients, micronutrients during prenatal period, all can initiate change right from the prenatal level and continue up to prenatal infancy, early childhood, and until the young adulthood period. And the similar thing goes with prevention focused on family adversities. Like for example, in case of bereavement, a divorce happening in the family, or a parent having a illness, or a substance abuse in a parent. All these in the family situation should be addressed by means of many social workers who can be a very good or appropriate family support. And right from prior to consumption, they are consuming appropriate nutrition and promoting the proper lifestyle modifications can improve their overall physical and mental health, and their prenatal care will be appropriate. And home visiting, early child interventions, parenting skill training, social behavioral skill training, classroom based curriculum, prevention, abuse, high risk behavior during childhood, early adolescence, and prevention of depression in early adolescence, young adulthood, and in adolescent and young adulthood, observing for signs for prodrome of schizophrenia and starting their prevention of schizophrenia strategies in them in case of indicated intervention prevention. All these play a major role in the prevention of variety of mental illnesses. So at each development phase, and appropriate intervention at that particular development phase is very important for proper prevention strategies by reducing the risky risk factors and by promoting the protective factors. And there is a new concept called gut brain axis, which is a complex communication system between the gastrointestinal system and the microorganisms which inhabit it, as well as the peripheral and central nervous systems. So it is also termed as the microbiota gut brain axis, and it constantly transmits and interprets information from periphery, that is the intestine, to the brain and back and forth. So exact mechanism of this communication is still under investigation, and it includes neural, endocrine, hypothalamo pituitary adrenal axis, and immune pathways. And these pathways are often found to be altered in psychiatric disorders. So, by targeting the gut microbiota, this entire communication of the neural pathway, endocrine pathway, immune pathway get altered, and this gut microbiota has a very high epigenetic modification potential, and this can be modified by means of prebiotics, probiotics, antibiotics, symbiotics, and postbiotics. And it is said that common psychiatric illnesses which are found to occur during the alteration in the gut brain microbiota axis, depression, anxiety, and schizophrenia. So, by appropriately altering our gut microbiota by means of promotion of short chain fatty acids, gut peptides, tryptophan metabolism, cytokine, cortisol, And by means of adding prebiotics, probiotics, symbiotics to our regular nutrition, we can prevent uh, disorders like depression, anxiety, schizophrenia from occurring. So these are my references. Thank you.